You may start.
Okay, my name is Dr. Anteneh Roba. I'm a physician practicing in Fairfax, Virginia, and also I have a clinic in Addis Ababa, Ethiopia, that just opened about half a year ago. I've been a practicing physician for over 20 years in the United States, and in the last 2 years I've been practicing exclusively anti-aging medicine and cosmetic medicine. I'm board certified in emergency medicine, aesthetic medicine, and obesity medicine as well, and I am a diplomat of the American Academy of Anti-Aging Medicine. I've been practicing anti-aging medicine and cosmetics for the last 2 years and decided to branch out to Ethiopia. In the United States, cosmetics medicine is booming. The trend is towards non-surgical treatment of cosmetic problems, and I thought by bringing this technology and this branch of medicine to Ethiopia would be a good idea, and so we opened our clinic called Zinnia Aesthetics and Anti-Aging here in Addis.
Okay, can you just briefly give us an overview of the industry and what do you expect from this business that you are launching in Addis?
As I stated before, the cosmetic industry has been proliferating in the United States as well as in Asia and Europe, mostly in the non-surgical area, and there are a lot of people here in Ethiopia and other parts of Africa that are interested in cosmetics and have to, in most cases, leave the country to go to other countries to get medical care. And we thought that it would be a good idea to bring the technology and the science to Ethiopia so that people don't have to travel to foreign countries like Dubai or Thailand or other places to get cosmetic care. And we have a full range of services that we are providing now, and we will be providing in the future that should satisfy the needs of most people here in Ethiopia and even other parts of Africa.
Is it not challenging for you to introduce such a new business for the country?
Oh, it is. It's very challenging, but at the same time very rewarding. Like I said, a lot of Ethiopians are already aware of the cosmetic services and are using these services, but they have to go to other countries to do this. And so, as challenging as it is also an opportunity for us to provide this service here in Ethiopia. The good thing is the government has been very cooperative and has been very supportive of our endeavors, even though we've had some issues that every new business in anywhere will face. But overall, I think things have been progressing quite nicely, and now we're settling down and we're going to expand our services to appeal to a broader segment of the population, both here Ethiopians and foreigners that live in Ethiopia. And hopefully our long-term goal is to be able to attract people from other countries, surrounding countries, to come and avail themselves of the services that we will be providing that most other places won't have.
Do you think we have the available human resource in your profession from local, or are you planning to bring some?
Right now, as far as we can tell, there aren't that many. However, I think the potential is there to recruit physicians and nurses locally and to train them so that they can be ready to partake in the cosmetic industry. So for the time being, I would say no, but I think the future is I think there are possibilities.
And regarding the industry-wise of the cosmetics industry, some are reluctant, cautious about the industry, the after effect of this cosmetics makeup. And what do you suggest about that? Comment?
The beauty about at least what we're providing is most of the procedures and the services that we provide are not invasive. There is no cutting, there's no opening, so the complications are minimal. We're utilizing technology that basically makes it possible for us to provide almost very similar care and give results that are very similar to surgical procedures without the complications. So that's the most encouraging part of this. The trend in the United States, for example, is people don't want surgical procedures. If they can avoid it, they'd rather do non-surgical procedures if they can get similar or equal results. And with the new technologies that are coming out, with the lasers and radio frequencies and other methodologies and treatment modalities, the need to do surgical procedures is decreasing, and hence the complications.
Tell us the specific services that you provide now at your service.
Okay, so we have, as I said, we have two clinics, one in Fairfax, Virginia, and the other one here in Addis Ababa. The one in the United States provides more services because we have more machines. In Ethiopia, we were starting out with limited services that we're going to expand very quickly, hopefully. In the United States, we provide all sorts of cosmetic procedures, including Botox and fillers and radio frequency, which is a treatment modality that uses heat to tighten skin and even to reduce fat, pockets of fat in different parts of the body. We use lasers for all sorts of lesions, pigmented and non-pigmented lesions, for hair removal and other things. We have a non-surgical method of removing fat called cool sculpting. We do fairly new procedures like PRP, or platelet-rich plasma, and we're even employing some treatment using stem cells. Other than that, we have anti-aging services. We do hormone replacement treatment. We do preventive medicine treatment. And because I'm board certified in obesity medicine, we do obesity management, medical weight management. Here in Ethiopia, we don't have all the machines that we need. They're rather expensive, and since we already have them in the United States, until such time that we're able financially to bring these equipment, we will not be providing some of the procedures that I mentioned, but we do basic cosmetic care in Addis. We do Botox, fillers, we do chemical peels, facials. We can do PRP here. We will be bringing hair transplant to Addis Ababa. We have technicians that are trained in the United States and have been doing hair replacements for years, and we've got them permission to come to Ethiopia and work with us, so we can do hair transplant. We can do procedures related to PRP, for hair restoration, for facial rejuvenation, for degenerative joint disease, and we also do preventive medicine. We try to do testing to predict years ahead if someone will develop cardiovascular diseases and diabetes, and we have preventive treatments to help people to avoid coming down with these horrible diseases. So our services are, vast, and we can do a lot of things both here in Ethiopia and especially in the United States. And in the future, we plan to bring body sculpting, basically a surgical form of it. We'll be doing what's called tumescent liposuction, that does not need general anesthesia, and also